Hello everyone, welcome to another episode of Ask FUH, and since this month is Breast Cancer Awareness Month, we are here again to talk about breast health. And today I have with me Dr. Abdul Rahman El Kinge, who is our medical oncologist consultant, and he's here to shed some more light about breast health and why October is an important month. So doctor, let us know more about it.
Thank you. First of all, regarding health, every day is important. But why we focus about October, or we call it Pink October, is because we are focusing and reminding the people about a good chunk of our community, the ladies. You know what? 35% of all cancers comes in breast. So this is the third of cancers. So October is important to show our care for our lady community, for the women. You know, we have our mothers, we have our sisters, we have our wives. So October is a more important month for all these category of patients, of people, of individuals. And this is a continuation. We're not gonna stop in October. This is happening every month, but October, just to put our all focus on that and not to forget that this is something, screening for breast cancer is very important.
Yeah, I think totally it serves as a reminder when you see everybody in pink and buildings lighting up pink. It's just an additional reminder that it's just not the month where you should go and talk about it, but it's a month to take action. If not today, then next month. But yearly screening is important, right? And 35%, that's a huge number. So there are various activities that we see around town and around the world happening. But what would you say would be the most proactive approach that women can take for their breast health?
Well, this is a message that should be prevailed in all healthcare systems, that we physicians, we should advise always for our community, our people, our women, that be proactive about your health. Now, because of this is October, be proactive about your health is actually early screening for breast cancer. Now, this has shown in so many studies that if you screen with a mammogram on a yearly basis for every lady age 40 and above, it can save your life. How it can save your life? Mammogram, the key point of it, it can detect the microcalcifications, which are the cases are probably precancerous before the development of cancer, or the small disease, which is less than a half a centimeter, probably early cancer. And whenever you diagnose at an earlier stage, the intervention that we do, the invasive intervention that we do is minimal, such as minimal surgery, most likely no chemotherapy, maybe radiation therapy or hormonal therapy. So it is very important that we spread the word that every lady at the age of 40 and above till the age of 74 should undergo a mammogram once per year only, to make sure that if there's anything, we do not miss it, and if there's something, we diagnose at a very early stage to safeguard the life of the lady and to ensure that any therapy that we provide is really minimal, does not affect her quality of life or a sequel in the future.
So, doctor, are there any considerations that women should be taking, specifically if they belong to a family with a family history, or who are, like you talked about age, above 40 we should do this yearly screening. So are there any specific consideration that should be considered when we talk about breast health and the early diagnosis?
It is a very good question, because we've seen it a lot, especially in our community. Every day we have individuals, patients coming saying that we have a positive family history of any type of cancer. Now, whenever we say positive family history of cancer, not only for breast, the genes that are related to breast cancer are also related to ovarian cancer, related to colon cancer, related to pancreatic cancer. So these information is important to mention it whenever you see a physician. Now, for this specific category of people, we tend to do the screening at an earlier age. Now, there's a lot of debate about that, but usually we start at the age of 35. But also we advise that we start screening at an age 10 years younger than your relative was diagnosed with cancer. So it could be like your relative has been diagnosed, or your mother has been diagnosed, let's say at the age of 39. So you may start screening at the age of 29. Now your question would be, would we do mammogram or something else?
Yes.
We know below the age of 40, mammogram is not that accurate.
Yeah.
So it's preferable to do an MRI at this point.
Okay.
And the debate, there's a lot. You can do MRI every year. intermittent with a mammogram every year or an ultrasound every year in order to try to detect things at an early stage, especially in ladies who have a positive, strong positive family history of breast cancer, all these multiple cancers that we discussed.
And what about a sonography that is usually advised?
Well, ultrasound is important, but ultrasound is observer independent. That means it's dependent on the physician, and it cannot see actually the microcalcifications. We discussed that the microcalcifications that we can see in the breast are probably a precancerous phase or an early cancer phase. So the ultrasound is not that accurate for that. So MRI is still more accurate at this early young age, or mammogram, okay? And ultrasound can be an additive imaging to detect further or characterize further the lesions that we can see.
And MRI is totally non-invasive, right?
So MRI is non-invasive. It's even safe in pregnant ladies. So it's non-invasive. It's just a bit, annoying when you do it, but then again, it's non-invasive at all.
Yes. So ladies, that's your cue. Even if you're a 35-year-old or if you have any of these considerations or risk factors, as we say, that can actually be a little bit alarming and you have been avoiding it, this is the month to take that action. When we spoke about MRI and it being non-invasive, but there are women, and I have friends who are afraid to do a mammography because they think, there would be pain when they do this procedure, and most of the time people read on Google and then they would come and get it done or have an idea, visualization about it, that this could be very painful or would cause discomfort to them afterwards. Is that a myth?
No, it's not. We know that the breast is a very sensitive organ for the lady. We fully understand that it may cause some discomfort. Yes, it is there. That's why we advise that the mammogram to be done usually 1 week after the end of the menstrual cycle. The pain should not be there. It is unusual, should not have been pain. But then again, it may happen. Again, the breast is different from each lady to the other lady. So it is a very sensitive organ. So some ladies will have a sensitive breast, so they have the pain. What we say is that bear the pain. Having a pain for a few minutes or less than a few minutes, few seconds is more important than actually having pain for a long period of time. It can have discomfort, no doubt. Pain is less, but be patient. It's once per year. You don't need to repeat it multiple times, and it's worth it to make sure that you are safe as well as your family is safe.
Yes, that reminds me of the quote, pain is inevitable and suffering is optional. So what would, on that note, what would you give as a take-home message? I heard you saying recently, talking about how even men play a role, and we all have, you have a wife, a daughter that you need to take care of. So what would be your take-home message to the females as well as males, being a doctor who sees these patients very often?
The first thing, again, be proactive about your health. Your health is very important for you and for your family. And don't be scared, don't be afraid. If you have any concerns, you can come to your family members or ask a physician that you trust who can share with you the information and at least help you to go through the process. Mammogram at the age of 40 and above is very important. Screening early can save your life and your friends and your family. So this is very important. As for the partners usually, what I know, they encourage their female partners for that. It's no more taboo. The lady should not be scared that if she feels something, does not share it with her partner. Yes. She should inform him, and most likely he will encourage her to do so. This is something important because he will realize that this is important for her or for him.
Yes. So good health is wealth is what I would say, and everybody should take that step this month.
Definitely.
Or if you don't find the time, the month next or the month next, but definitely you should do it. That's my take-home message. And thank you so much, Doctor, for being here today and helping us spread more awareness year on year. And I hope we will benefit from this. Thank you.
Thank you.